When elected officials see Georgia Stand Up coming with our orange shirts on with the community, and they say, oh, what do you want now? When we hear that they're concerned about our issues because we're showing up with 50 to 100 people, and people are demanding in a responsible way that their elected officials serve them, that's community power.
No chance, then no peace. No chance, then no peace. No chance, then no peace. No chance, then no peace.
What public health is really starting to get is the social determinants of health. They understand that health inequities are the result of inequities in housing and in transportation, in criminal justice, and all of these areas.
It's not just about, visiting a doctor, but it's about parks, and it's about access to food, and it's about whether you're safe walking home from school.
Whether you have a roof over your head, transportation, a job where you can afford to put healthy food on the table for yourself and your families.
One of the things that we'd been insisting on for a very long period of time was the power of organizing.
Righteous rage is centered in love. So rage is not the opposite of love, right? Indifference is the opposite of love. And that's what our communities have been experiencing.
To have our communities really live comfortably and with dignity, we need to ensure that they're getting paid for what their work is worth, and that rents or housing costs are simply manageable.
If neighborhoods aren't organized, especially with so much development happening so rapidly, this is when displacement happens.
There's, data out there now to tell you how long you're gonna live by your zip code. Housing is the nucleus to all these other intersectional issues.
When I see the suffering in our communities, when I see that elected officials are ignoring the desires of the electorate and they haven't expanded Medicaid and people are actually dying, we need to build more power.
Clayton County has the world's busiest airport. The county actually stopped bus service. And so many of the residents were walking alongside the streets and the sidewalks looking for a way to get to work.
If we've got community members identifying what the problems are, identifying what the solutions are, and doing the organizing and power building that lifts those obstacles, it's very different than if an agency comes in from outside.
Any attempt to transform this system has to be led by and informed by the wisdom, the experience, and the intelligence, frankly, of those who have lived and been discriminated against by those systems.
The solution is to organize the people in such a way that they understand and believe and know that they are the power.
The City of Boulder sees organizing as a tool that can support community members and support the health of individuals and entire neighborhoods. When we do get community involved, better policies are passed.
In 2016, we passed a ballot initiative to increase the minimum wage to $12. In 2019, we passed a bill to allow local municipalities to increase their own minimum wage.
Community power gives us the opportunity to really have a platform to talk about what's most important to us. Our goal is to make housing a human right.
For every effort that we embark on, there's a legislative approach, organizing and boots on the ground strategy, a litigation communications, and there's a technology strategy.
We had coalition members come together, we knocked on doors, we called people, we had activities to get the awareness out there. And we were surprised that people were willing to tax themselves to get transportation. Every time I see that bus go up the street, I just get excited because we know that we were a part of that success.
We cannot continue down this path where so many people do not have access to the basic and fundamental ingredients for a healthy and balanced life.
For public health to really make an impact on health inequity, then it needs to shift power imbalances that are fueled by various forms of oppression like racism and sexism.
And now there's a big opening to understand that public health will only be achieved if communities have the power to voice their concerns and to shift the political calculus that decides where resources get directed.
If we are going to build a society that works for all of our families, it is critical that we evaluate the problems and that we develop solutions through a race, gender, and class lens. Not one or the other, but all of them.